Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about ICD-10 CM PCS updates 2023 fourth quarter part 11. In this video, we are going to cover two coding clinics, and the first one is chronic lung allograft dysfunction and the second one is appendicitis with generalized peritonitis with and without perforation. So let's get started with the first one, chronic lung allograft dysfunction. So the update here is new codes have been created to identify restrictive, chronic and other lung allograft dysfunction as follows. J4A.0 for restrictive allograft syndrome, J4A.8 for other chronic lung allograft dysfunction, and J4A.9 for chronic lung allograft dysfunction unspecified. So let's move toward the next coding clinic, and that is appendicitis with generalized peritonitis with and without perforation. Appendicitis with perforation or rupture typically results in severe peritonitis. However, there are instances when appendicitis occurs with microperforations that can lead to generalized peritonitis. So the update here is codes K35.20 acute appendicitis with generalized peritonitis without abscess and K35.21 acute appendicitis with generalized peritonitis with abscess have been expanded to classify acute appendicitis with generalized peritonitis with perforation, without perforation and unspecified as to perforation. So three new codes have been added under each subcategory as follows. So for the subcategory K35.20, three codes have been added, and for the subcategory K35.21, three new codes have been added. Subcategory K35.20 has been further expanded as K35.200 for acute appendicitis with generalized peritonitis without perforation or abscess, K35.201 acute appendicitis with generalized peritonitis with perforation without abscess, and K35.209 for acute appendicitis with generalized peritonitis without abscess unspecified as to perforation. So as you can observe here that the terms without perforation, with perforation and unspecified as to perforation have been added to these subcategories. And similarly for the subcategory K35.21, three new codes have been added, and they are K35.210 for acute appendicitis with generalized peritonitis without perforation with abscess, and K35.211 acute appendicitis with generalized peritonitis with perforation and abscess, and K35.219 for acute appendicitis with generalized peritonitis with abscess unspecified as to perforation. So here also for the subcategory K35.21, that is acute appendicitis with generalized peritonitis with abscess, has inclusion of the terms without perforation, with perforation and unspecified as to perforation.
Please like, share and subscribe to Expert Medical Coding. Thanks for watching.